Dr. Khan reviewing and reacting to PITT, the HBO Max series that's taken all healthcare professionals by surprise because it is the most realistic medical drama out there. It feels like a love letter to healthcare professionals. Stay tuned for the rest of the episode. Make sure to click like and subscribe. Leave a comment below to let me know what you think.
What do you need, Robin?
Dr. Rabinovich. This is Dr. Tracy Morris, Regional Manager of ECQ America.
The contract management group. If you'll excuse me, I'm a little slammed as per usual.
We were upstairs with the executive team going over a proposal.
A proposal?
We're interested in having your emergency department join us.
The 500 or so ERs you have aren't enough?
What can I say? Business is good.
Yeah? For who?
Everyone benefits.
Do they, though? Your contract management's corporate mandate is profits for shareholders above everything else, yes?
Robbie?
Yes.
Does your proposal include the part where you cut the pay for all my doctors?
Maybe I can find an incentive for you. How does regional medical director sound? Lighter workload, better benefits.
Did you go to business school or medical school?
Both. We look forward to your decision.
Of course.
Hopefully, we'll get a chance to work together soon, Dr. Rabinovich.
I can't believe you're seriously considering this.
Bottom line is our current numbers aren't good and theirs are.
What a spicy scene. This scene highlights the distinction between frontline workers and administration. So think about it this way. Frontline workers are the doctors, like the ER doctors, the hospitalists, the primary care doctors, any healthcare professional that's on the front lines. And then administration is all the business executives, all the people that are organizing the business structure, the operational people, the people that keep the lights on. Okay. As I mentioned in another video, it's a symbiotic relationship. Healthcare and doctors being a business is something. They need us. We need them. I am one of them. They are one of us. It is a third part of the story that they're highlighting in this clip, which is that recently consultant management groups have bought up smaller medical practices. The goal is to improve efficiency and profits. Unfortunately, what ends up happening is the people doing the hard work on the front lines get the short end of the stick, meaning doctors' workload increases, the contracts are changed, financial rewards go to the administrators rather than people who are working on the front lines. They were sold to another company and then they were required to see more patients and they didn't reap the benefits of seeing more patients or doing more work. It's kind of a tough situation, but this is definitely happening.
Okay, Chanel, all set.
How bad does it look?
I'm gonna be honest with you, it doesn't look great. Thankfully, there's no signs of infection.
I'm such an idiot.
Dr. Moore,
I'll be right back. I've only been in with her for a few minutes.
I didn't say anything. What's the case?
Chanel Sutton, 22, complications from silicone butt injections. She found the guy on TikTok. He did the injections in his living room. She thinks it was maybe silicone cock from Home Depot.
Wow, living room?
Jesus, really?
It's tachycardic and tachypnic. I think it's a panic attack, but if a piece of silicone hit a vein, she could have a pulmonary embolism. We should scan her.
Good. How's Joyce, our sickle cell patient, doing?
Holding up. She's intubated and waiting on an ICU bed.
Good. Keep it up.
Will do.
Team round, CWA. Team round, CWA.
Come join us when you're finished.
As soon as I put in a few orders.
That's terrible. Geez, there are so many bad decisions in life. And look, I'm not here to judge. There's nothing wrong with plastic surgery. There's nothing wrong with wanting to feel better on the outside and inside. But there is something wrong with doing something on the black market. It can cause permanent, irreversible damage. I did a quick search, and in a survey of plastic surgeons, 84% had treated patients with complications from non-medical grade butt injections. Also, that clip was so full of so many information. That clip was like, 60 seconds long, and 3 major topics were discussed. The lady whose plastic surgery went wrong, sickle cell patient, and also there's an overhead announcement that they're about to have a meeting. So do you see how quickly doctors have to think, act, and speak, process communication, both receiving and giving? It is a lot of hard work. It's kind of funny, but I think it's a good point here to start talking about what doctors actually do aside from having their medical knowledge. She said, as soon as I finish my orders, as soon as I put in some orders, then she'll come and join the meeting. So the word orders is actually a written or a verbal order that a doctor gives to the patient, but via the nurse who has to execute the order, or the pharmacy tech who has to prepare that medication from the pharmacy, send it to the nurse. So orders are like very crystal clear, Tylenol 650 milligrams orally once every 8 hours as needed for pain. If you don't have that order in the computer system in the emergency room or in the hospital, you can't give it to the patient, and the patient can't just like reach into their purse and take their own Tylenol if they have a headache, or take their own Motrin, because you're technically under hospital responsibility. Your health is the responsibility of the people who have more knowledge and who've had more experience. The common things we order are medications, blood tests, imaging tests like CT scans, x-rays, MRIs. Those are the common orders we write.
Still need 10 more over.
Never thought I'd see the day where you'd wish for more Samira.
You can blame Gloria for that. If I don't get patient satisfaction scores up around here, they're bringing in an outside management company to run things.
Mother of God,
Yep.
really?
Any word back on Nick Bradley's cerebral perfusion test?
Still waiting on results.
What about Ipecac, Mom? Teresa Saunders?
Lung fluid should be good to go soon. See, we do have patients that appreciate you.
Okay, that's funny as hell. The old lady flipping him off. But let's talk about this. He said outside management company, and a few of you were upset by my statement on a previous episode that said healthcare is both a basic human right and a business. It's not anyone's fault or something. It's more just like the way it is in America, at least, right? So if you're in this system, it's good to learn about it and know about it, as opposed to just acting like it doesn't exist or I don't like it. It just sounds so icky to have an outside management company. I kind of get it, but at the same time, healthcare is the only industry that hasn't really progressed in terms of pay. Like back in the 70s, lawyers and doctors made the same amount of money. And now, if you watch interviews about the PITT and how Noah Wiley, the actor who plays Dr. Robbie, speaks about it, he highlights a lot of the struggle of healthcare and healthcare professionals. And it's not because we need to have a gajillion dollars. It's just because validation and recognition for the type of work that we're doing is really important. I remember during COVID in 2020 was the first time I ever really felt like a real big thank you. Like people were clapping outside of their houses and, they were cheering and, oh, I'm a healthcare worker. And I started seeing patients in the office and people were just really grateful for my care. And I just thought, like, I didn't know how important that was to me. It sure was, because it actually made me want to work better and harder. But in a hospital setting, everyone's sick. They don't feel good. They don't want to say thank you. They're not even thinking about thanking you. And yes, while it is the job of the hospitalist, it's the job of the ER doctor, it is really nice to hear thank you.
Hey, do you think they're going to give us lunch? It's past 12 and I'm starving.
I would pack a bunch of these for your next shift, or grab a sandwich from the patient bin. There's no time for breaks around here.
Thanks.
Doctors that work in a hospital don't get a lunch break. It's just not a thing. Like I remember friends that would want to visit me were like, when was your lunch break? There's no such thing as a lunch break for doctors that work shift work. You're always on during your shift. So you're lucky if you eat at all. And many doctors eat standing up or like grab a quick snack. The legal protections are often absent. There's no labor laws required breaks for physicians.
I just want to remind you all of a few things, okay? So we do a great job coming up with the right diagnosis and treatment plan for our patients, but there are still some opportunities for improvement.
Not this bullshit again.
Always sit down at the bedside of a stable patient. It will make you a better doctor. Second, if there's a discharge to be done, do it before you pick up a new patient. The patients are very aware of the time that they spend with us, so please don't keep them here any longer than they need to be. I get it, but for the sake of efficiency and running smoothly on our end and opening up beds and opening up rooms, let's discharge before we start with somebody new, okay? In your medical records, make sure that your decision-making and your notes reflect not just the diagnosis, but all the thought that you put into ruling out all the critical illnesses in the differential.
The hospital won't admit this, but it's less about charting and more about profit.
Okay, good. That's it.
That was quite a powwow. So Dr. Robbie just gave the whole group a bunch of things to remember, which is like discharge before you pick up a new patient. Patients are acutely aware of how long they stay there. That's true. But it's also, he's saying that because he's trying to implement some of the efficiencies that the management company would bring in. The entire documentation piece is so critical. If you didn't document it, you didn't do it. The way that the doctors have started to improve their documentation is by using AI scribes. The AI scribe that I started to use is HIPAA compliant, and I let the patients know in the beginning, and it's really changed the game in terms of documentation, because now I'm not like triple, quadruple tasking while typing and listening and thinking about what orders to write. I'm actually just listening to the patient making up formulations, asking a lot of great questions, and then the scribe will compile the note. So that's been a game changer for documentation. The thing that I learned in the documentation that a lot of people miss, especially in primary care, is that the chart has to match, meaning the chief complaint, which you wouldn't know about because chief complaints are the reason for the visit. So they really should be written in quotation marks when you're in medical school or residency. The documentation has to match between the chief complaint, the history of present illness, the assessment, and the plan. The SOAP note format is what we're talking about: subjective, objective, assessment, and plan. I actually created a note template on iPhones for my friends and family so they can use that as their own personal chart. And it's really, really helped. I implore everyone, I challenge you to open up a note on your iPhone right now and call it like Bob's chart or Mary's chart every once a month or every 6 months or however often you want to. And then you write PCP's name and number, active medication.
Go for it.
Now, everyone knows McBurney's point, but who can tell me the name of this sign? Tim, raise your right leg, please.
Oh! Psoas sign, causing friction of the psoas muscle over the inflamed appendix.
Excellent. Now, back in the day, appendicitis meant you went straight to the OR. Who can tell me about the CODA study?
Well, it's from a 2020 New England Journal trial comparing surgery to antibiotics. It showed that without an appendicolith, there was a 75% success rate in the antibiotic-only group.
Exactly. Honey, we discussed the study at home, right?
Honey? Wait. She's your mom?
It's Victoria. Or Javadi. Dr. Shamsi?
Hello? Oh, yeah, I'll be right there. Mrs. Grant now has chest pain, if you'll excuse us.
Oh, yeah, go.
Moms, we love you and we know you're so proud of us, but we're not babies, especially at work. So, honey, that's not going to work. This show is just so sensitive about relational dynamics, and that's so good. Relationships are super important. But let's talk about the CODA study. I love that she brought it up and that this show is teaching us about it. So it's comparison in outcomes of antibiotic drugs versus appendectomy, CODA. Like she said, back in the day, appendix burst, rupture, inflammation, appendicitis, out now. Nowadays, we can give antibiotics and about 75% of patients are okay with just pills to treat the appendix. The appendix is this tiny little appendage at the beginning of the ascending colon. So we have a whole GI tract that's like basically one long pipe from the mouth all the way to the anus. We all have them, but if they get infected, which means retained feces, which means people who are constipated, who don't have enough fiber, aren't drinking a lot of water, they can get appendicitis or diverticulitis or recurrent things like that. People think that more is always better when it comes to healthcare, but this CODA study proved that wrong. So that's great.
Normal head CT, small hemothorax on the right.
Which is now turned into a huge collection of blood. I would love to do the chest tube.
You got it. I'll guide you. Fifth intercostal space, anterior axillary line. Perfect.
Oh my god, are you okay?
Oh, that's gotta hurt.
Leave it! But
Okay, I'm stepping in.
Nope, you're not gloved. I got this.
on my own.
Okay, she just dropped a knife into her foot, but things happen. It just happens. It's no one's fault. Let's talk about what a hematoma is. They're saying a small hematoma from the thorax expanded and it's collapsing the lung. So think about this. 2 lungs, right? They're like cone-shaped organs, and they're covered by a saran wrap layer, kind of like 2 saran wrap layers. So they're very thin membranes. One's covering the actual lung and the other one is covering that covering, but there's a little lubricating space in between. A hematoma is a blood collection. And so if it expands, that means now the lung has no place to go physically. So the lung is collapsing. And the only way to get that blood collection out is by sticking a knife and then a tube into that space. They can drain the hematoma and the lung has room to expand, and then you can oxygenate safely.
I hear you have an 85-year-old patient who may have been abandoned by her primary caregiver.
We can't find the daughter, and I'm really worried about the mom.
Slow down. We'll figure this out. What do you think happened?
Well, Ginger has schizophrenia, and she fell, and the daughter was already so overwhelmed. I mean, maybe she ran. I don't want to say this is elder neglect, but...
Don't jump to the worst case yet. I'll see if I could get a hold of any other family members.
You know, I told the daughter, I told her to take a break. I didn't think that she was going to dump her mom, so...
This isn't your fault.
We're seeing more cases like this as baby boomers age. It's really tough on their families.
Yes, it is really tough on their families. Caregivers, shout out. Anytime we can, we're going to give you a highlight. We don't get to praise you enough. You're the real silent backbone of the healthcare system. And it is true. We're starting to see more people bring their baby boomer aging parents to the ER. And interestingly, the caregiver wage as of June 2025 in the United States nationally is about $16.49 per hour. For live-in caregivers, it's a little bit more, $22.47 an hour, which is translating to an annual salary of $46,742. It's not that much. And in California, we have a program called In-Home Support Services, IHSS, which is the program that California provides home-based services to individuals that are elderly or blind or disabled who need assistance with activities of daily living, the ADLs. The goals is to help these people live independently in their home as opposed to a nursing home.
If I showed you, this is a healthy brain. See the black? That's blood flowing to the cerebrum. When there's no blood flow.
It's white.
Yes.
He's brain dead.
I am so very sorry.
I prayed, I had hope.
We all did.
So he's not coming back.
No. The apnea test and now the perfusion scan prove that.
Clear
What
is
happens
kind.
now?
The way he just says
Hooked
no
up to all those machines.
firmly.
Take some time. Try to process this news. The family support specialist will come in very soon and help you through the next steps.
Thank you.
Are you okay?
Yeah. I just had to show the parents of the ODT and the perfusion scan results.
It's just good to see what you're talking about instead of just hear what you're talking about. So feel free to ever, when you're being described something by a doctor, ask them to show you a picture.
Oh, it never gets easier.
Is that Dr. Robbie? You owe me a dance.
Looks like an opportunity to boost your patient satisfaction.
The emotional agility that doctors have to go through during a roller coaster. First, he's like consoling this sweet family while they just lost their son. And then this cute little old lady's like giggling at him and talking to him. And, you know, of course, it's just requires so much emotional agility.
Zero form first, then 2 cut 4x4s.
You, follow me. You're confident. That's good. But there's a fine line between confidence and cockiness.
Yep.
Should I draw your blood? You already did.
Yeah, I mean, for the HIV and hepatitis panels.
So what she's talking about with HIV and hepatitis panels, so it's called a needle stick injury in the hospital. It happens sometimes where a healthcare worker is stuck with a needle unintentionally from a patient's blood. So what they're talking about is we test the injured person, healthcare person, and the patient for HIV, hepatitis B, and hepatitis C, which are bloodborne pathogens.
4.
Forearm x-rays are back on Mr. Ofori in the South Corridor. You can discharge with a volar splint. Notify ortho. ADF.
Always discharge first. Got it.
4-year-old with a fever. Your medical decision-making says otitis media.
Yeah, she had an ear infection.
Did you also consider and rule out meningitis, mastoiditis, malignant otitis externa?
I did.
Then you should document your cognitive work in the MDM.
You want me to pad my chart?
No, I want you to show your work. Billing is a side effect of that. Did anyone listen to what I said earlier?
Neurocystic
Always discharge first, ADF, document what you've done, document what you're thinking about. Billing is a side effect of the documentation, but it's also really, really important legally to document what you were thinking and how you ruled it out. God forbid there's a bad outcome and they go through the chart, which is literally the only thing that you have for your memory, especially when you're taking care of so many people.
Neurocystic parasite in your brain.
I thought I just had a migraine, but I have bugs in my head.
Well, not exactly. You
Ooh, yes,
had
bugs.
larvae
Wow.
from a pork tapeworm that made multiple cysts, but they're all dead now.
A worm in my head. Are you kidding me?
No, you don't have a worm in your head.
You just said that I have.
I said you had a worm in your head, but it's dead and long gone. What we're seeing on the CT is scarring around those dead cysts.
Like dead worm eggs.
Larvae.
Is my brain like Swiss cheese? Am I dying?
No, you're not
No,
dying.
Joseph, you're going to be okay. The cysts are tiny and they're calcified over. There'll be no further damage. The little calcified spots will stay there.
So there's going to be a worm graveyard in my brain forever.
Yeah, but they're resting in peace.
As in, they'll be resting in peace. So, neurocysticercosis is a very interesting disease. So, we ingest undercooked or raw pork, and that's where the parasite larvae live. And yes, the whole concept of it is nauseating, but at the same time, it's treatable. The way your food is prepared is super important, especially in places with modern healthcare. There's a lot of social media craze about parasite cleanses. A lot of them are interesting to me, but there are real symptoms and there are real treatments for parasites, like anti-parasite medication. And parasite cleanses, I think, are a little bit of a marketing tool to get people to buy specific herbs and remedies when they don't have a diagnosis of a parasite. And those things could be harmful to the liver. So it's just really good to be wise, do your research, but also talk to a healthcare provider before you start diagnosing and treating yourself.
Behavioral health specialist.
I don't need that.
Did you talk to anybody after your husband passed?
Friends, family.
Devastating personal loss can be very hard to manage on your own. It's okay to need help.
The more resistant someone is to something where she goes like, I don't need that, that is more likely that they need that thing. It's the only way out of a tough situation that you don't think you need. Talk about it with friends and family. Therapy is obviously very important. Professional help is very different than talking to friends and family. Professional help is with the right person. Some therapists get in there with you and kind of get messy and vulnerable and raw. And some therapists are a little more reserved and kind of let you unfold whatever you want to unfold.
I work at a college as a janitor, even though I feel like I'm smarter than most of the people that go there. Sometimes I see an equation written on a blackboard, like half an equation, and I'll just figure it out.
Is this Goodwill Hunting?
It's just important to have a good relationship with the therapist. And that was really awesome of Dr. Robbie. He scheduled the appointment for her, pulled up the chair eye level, and he was just an amazing doctor. He went above and beyond his call of duty.
It might even improve your communication with David.
Okay.
Great. I phoned in a favor with behavioral health. They can get you in to see a psychologist at 1:30. Okay, I'll let you talk.
Doctor, can you stay, please?
Sure. Happy to be here. Emma's really the expert, though.
I understand your son is in here and not doing well. Can you tell me what Dr. Robbie has told you about Nick's unfortunate situation?
There's no blood going to Nick's brain. He's brain dead. So, he's dead.
I'm so sorry for your loss.
He was a wonderful son.
He would have been a great man. I can't believe this is happening.
I know how difficult this must be for you.
Can you tell us what happens now?
Yes, I can walk you through all the next steps. I'll reach out to a funeral director and get the paperwork started on arrangements. What's the name of your church?
St. Mary's.
Great.
Family asked the doctor to stay in the room, which was really sweet. The doctor stays basically to create more space, literally, for this tough conversation. And I really wanted to point out how slowly the nurse is talking to, or the representative is talking to the family. So in difficult conversations, it is so crucial for everyone to have a lot of patience and space and speak slowly, because it's a tougher conversation and things aren't going to be bam, bam, bam.
Thank you.
Do you have any other questions?
I think we should talk about something else that is very important. Your son's driver's license indicated that he wanted to be an organ and tissue donor upon death. That means he's given his permission for it.
No, I don't want to talk about that. No, he was too young to make that kind of decision.
I can understand why you would think that, but he was 18.
No, you didn't know him. He is still my son.
That's so incredibly hard for a mother, for a father, for anyone to go through. But it sounds like the young man was a giving person and he wanted to donate his organs, but she's clearly not ready for that conversation. So time is the only thing that you can do.
Oh, what is all this?
Lunch from Annie's. It appears that we have at least one grateful patient.
Hope is alive. Who do we have to thank?
I don't know. I think there's a card. Bottom of the bag.
It appears that we have at least one grateful patient. It is so true. Like I was saying earlier in this episode, like the first time I started hearing thank you genuinely and recurrently was like during the COVID pandemic. It is just so appreciative, and people do send food. It's not that they don't, they do say thank you, but it is just like she said, at least we have one grateful patient, not someone who's wilding out about the ER times or the wait times or why everything is so slow. That's it for this week's episode of The PITT. We'll be going over the whole season, so make sure you hit like and subscribe to be notified for the next episode. In the meantime, check out the next video, which is 5 ways you could focus on your longevity.